Hello everyone, I'm Miranda Tafumane and I'm a nurse and I work in the ICB as an Assistant Director of Quality. I just want to take us on a journey. When we set up to promote the International Nurses Day, the first thought was, will I find nurses in the ICB? And the amazing part is, yes, we found nurses in the ICB. We are going to be hearing stories of nurses from across the ICB. We have nurses in quality, we have nurses who are working in the transformation team, we've got nurses working in the population development team, we've got nurses even in the communications team. So I'd like you to just listen out and be inspired by the nurses in the ICB. Thank you.
I'm not actually convinced that I chose nursing as a career. I sort of fell into it. So initially I started off by working in nurseries and early years, but I'd always had a passion for working with children. And I remember when I left the last nursery I was working at, and everybody was really sad, but I said, actually, I'm going to work in a different capacity with children. So it sort of found me, and it just made logical sense to move into nursing.
So I've worked in all parts of healthcare across the NHS over the last 30 years. This feels like a real rounding up of my career. I've been a chief nurse and now I've come to really influence at a much more system level. There's 1.8 million people living in North Central London, and we have a chance to influence and prioritise their care.
I have been with the ICB since 2015 when it was called Clinical Commissioning Group. I joined to drive excellence in the quality of care provided by care homes and other social care settings. I also wanted to ensure that care home residents, their families, and social care staff had a voice in a way that services were commissioned for them.
So what Our Future Our Nurses means for me is about investing in our young people. So going into schools early to let them know that actually working as a nurse is more than working in a hospital, in a uniform. I mean, I work in an office, I have a white collar, but I'm still a nurse. I'm still able to affect change, I'm still able to support, and still able to fulfill my passion of caring for young people.
If I think of our future, our nurses, we have to look at what's happening in the future for our nurses. To know that technology is part of our future, and we're already bringing our nursing into the technology. So we need to look at our younger generation and say, you know what, you've got the tools, you're using them every day, you need to be part of the future of nursing, we need to be respected, we need to know that what we have, the knowledge and skills that we have are there, we can use them, they need to better use us and just embrace what we know and respect us for that.
Our future, our nurses, what does that mean to me? I think what it feels is I would love to see a future for nurses, for the young generation to take up this role as a career. But I want them to experience a better professional experience whilst they're practicing this role. I see nursing as a vocation rather than a job that you do for money and you get the salary. I think your medical knowledge counts, but your behavioral, your character, your personality adds to it as well. I want nursing to be a respected job in the future.
The future of nursing, for me, is a more diverse, inclusive, innovative, and strong workforce who will continue to demand equality, respect, recognition, a safe and positive working environment, and fair pay. I can also see nurses being at the forefront of global climate action and digital advancements.
So I would like nursing in the future to be a fulfilling, ambitious workforce that stays and that we look after them well and we pay them well. And I want to see more parity amongst the professions so that we hear nurses' voices as loud and clear as we do others.
I would say to a student thinking about going into nursing to be really sure that it's something you want to do. It takes a lot of commitment, it takes a lot of emotional involvement, and I would say if you want to do it, be sure about it. My pledge would be to keep supporting my colleagues, to keep supporting families and children that I work with, and support those coming into the profession.
I think my pledge would be to promote nursing as a respectable role.
Nursing history. Nursing predates the 19th century. A collective group of people that care for the sick, disabled, dying and injured. Nursing to health or making death comfortable. Remembering where it all started. Florence Nightingale, the lady with the lamp. Dealing with epidemics and not forgetting Mary Seacole. In 2023, we work everywhere, independently and collaboratively, advocating for our patients in the traditional hospital, community practice, universities, general practice, integrated care board, paediatrics, mental health and learning disability. Our skill set continuing to advance. Hashtag our nurses, our futures. Hashtag nurses in the ICB. Hashtag nursing in the ICS.